Good evening, all. Myself, Meena Balaji. I'm a third year medical student from Raichur Institute of Medical Sciences, Raichur. And today I have with us Dr. Gaurav Datta. Sir is a ENT person, and Sir has completed his MBBS from Government Medical College, Bhavnagar, and he has completed his MS Otorhinolaryngology and Head and Neck Surgery, which we popularly call as ENT, from Government Medical College, Baroda. And Sir is currently working as senior resident at SSG Government Hospital, Baroda. And Sir is a gold medalist throughout his academic journey. Hearty welcome to you, Sir.
Thank you very much for the warm welcome.
Thank you, sir.
I would like to
Shall we
introduce
start the
myself.
interview, sir?
I have done, yes, sure. Before starting the interview, I would like to introduce you myself. I am Dr. Gaurav Datta. I have done my schooling from Jamnagar. I have done my MBBS from Government Medical College, Bhavnagar, and I have pursued my MS ENT degree from Government Medical College, Baroda. Right now, I am pursuing my senior residency in MS ENT at SSG Hospital, Baroda.
Great, sir. So, going to the interview, could you tell us about, could you give us a brief introduction about ENT as a branch, sir?
Okay, so ENT, the name is revised right now as the otorhinolaryngology. As the name says, that auto means ear, rhino means nose, and laryngology means larynx. And it also includes the head and neck surgery. So everything above the clavicle, excluding the brain and eyes, everything comes under the domain of otorhinolaryngology and head and neck surgery. The brain is dealt by the neurosurgeon, whereas the eyes are dealt by the ophthalmologist. Even the globe, that is the orbit, is included by the ENT surgeon. Okay, so when we read the ENT subject during our MBBS course, we find that there is a very limited syllabus and limited surgeries in ENT. But as we come across the work in our PG life, we come to know that there is a tremendous and cumbersome work. There is a tremendous and cumbersome work which we have to do in the field of ENT. Right now, it's not just ear, nose, and throat, but it's everything through which all the surgeries which we can approach through ear, nose, and throat. Like through nose, we can go till the third ventricle also. Through ear, we can go till the posterior fossa tumors also. So it's not like only ear, nose, and throat. It's everything that can be approached through ear, nose, and throat. So even the neurosurgeons take the approach of the transcervical odontoid surgeries, which they do for the vertebra. That surgery is done through the transoral approach, where there is a need of ENT surgeon also. So to summarize whatever I said till now, you should not think that it's only ear, nose, and throat, but it's much more than what we have read during our UG days.
True, sir. And coming to the next question, during what can one expect during the 3 years of residentship in ENT, sir?
I would like to say that generally during the 3 years of residency, not only for ENT, each and every branch, starting from anatomy till orthopedics or radiology, okay, all branches have their own hecticness. It all depends on your institution, it all depends on the seniors, it all depends on the consultants. Okay, as ENT is a surgical branch, you can't expect to have some free time during your at least first year residency. Your first year residency word itself says that you have to stay in the residential premises of your hospital. So you are not allowed to go outside your campus for entire 1 year period. Okay. In first year you have to, like in my hospital, I would say I have 2 units. Each unit has 3 residents. Okay. So we have a team of 3 first years, 3 second years, 3 third years, and 1 or 2 senior residents. Okay, and 1 or 2 consultants as per the MCA recognition is there. Right now we have 2 consultants per unit. So we have alternate emergencies during a week, and every alternate Sunday we have an extra emergency. So you can imagine that what amount of load we can have when one day you will see OPD, next day you will do surgery. And during the OPD day you have to see the emergency also. So there is no space for any free time which you will get during your first year at least. But if you take this as a positive way, you will have so much of cases to learn, so much of things to learn. Okay, you are here to learn, you are not here to find some free time. So it's good that you will get work. Whatever work you will do in your first year, that will help that will make the foundation of your entire life as your career. So all the 3 years of residency have their roles in your professional life. The first year will help you to become strong enough to stay strong during your emergencies, to handle hundreds of patients single-handedly, and next day without sleeping the entire night also you should be able to attend all the surgeries next day. And after that again emergency, again surgery, like that. It will help to increase, to empower your endurance. That is what first year is about. It is about how to prepare the patient, how to document all the surgeries, how to see the OPD, what all things you should learn from your seniors and consultants. That's what makes your first year residency. The second year residency, it is a transition phase from first year to third year. Means you have to teach your first years and you have to learn from your third years and consultants. So that is a bridge between first and third year. So you should start reading your subject thoroughly from second year, and you will start getting enough surgeries in your second year itself. The third year is the most crucial year according to me, because there every responsibility of your first and second year will be upon you. You will be the registrar of your department. So anything which will happen by the first year you will be responsible for all that. Okay. Plus you have to complete your studies, plus you have to complete your thesis, plus you have to complete your poster and paper presentation. All those things have to be compulsorily finished by at least 6 months before your final PG exams. So third year itself is a very hectic year. You may not have to take rounds of the ward. You may not know each and every patient. Like you need not stay in the ward for 24/7, but you have more other important work which you have to accomplish during a period of 1 year. And also the consultants will be in direct contact with you in your third year. So you indirectly have to know all the patients. That will be dependent on how good your R1 and R2 are. So all 3 years are challenging in their own aspects, and we will have the enough training to tackle all those complications and conditions.
Definitely, sir. Medicine itself is a tough journey, but when you put your heart into something, I think everything is possible. And coming to the next question, what do you like the most about your branch?
I like my branch in every aspect because it is not so hectic, because I'm a person who like to work from 9 to 5. Okay. I need some time to rest because my mind and my body need some rest. So ENT is a branch where you can, during your OT days or off-call days, you can, if your OT is finished, then you can go and take some rest. Okay. It is not so hectic branch compared to general surgery and orthopedics. The people in ENT are calm and quiet. Okay. Like they are not so aggressive like other branches, other surgical branches. Okay. And the surgeries are also very precise. You don't need any physical strength for that. Okay. And it is a very emerging branch. All the surgeries which were done 10 years ago, all those have been replaced by endoscopes, microscopes, and robotic surgeries and all that. So it is a ever advancing branch. There is no boundary. The sky is the limit for this branch. Okay. And if you like the anatomy of head and neck, then ENT is the best branch for you. And you can say that it is, right now it is not an end branch, but if you are MS ENT, then at least you can do very well in your life. You need not compulsorily do some MCH or other super specialties after ENT. You need not do. It's not compulsory that you have to do. But in today's scenario, there are many fellowships and MCH programs after the MS which you can pursue. But if you don't pursue, it doesn't mean that you are lacking behind the other people. Only MS ENT can pursue a very peaceful life also. So in all these aspects, I find ENT to be a very good and peaceful branch.
The next question is, could you tell us the pros and cons of your branch?
Okay, the pros and cons, first of all, is a subjective thing. Okay, some people will find the overwork to be a pro and some will find to be a con. So it depends on person to person. But for me, I would like to say the pros of this branch are, as I've said, that it's a surgical branch. If you want to hold a scalpel in your knife, okay, you want to explore the anatomy, okay, then it's the best branch and it's the perfect amalgamation of medicine and surgery, because a polyp can be treated by giving the intranasal steroids also, and it can be treated by doing a functional endoscopic sinus surgery also. Same goes for a cholesteatoma, and same goes for any neck pathology. Okay, so everywhere there is a role of medicines and there is a role of surgery also. So you should have a basic knowledge of prescription of a medicine and of performing a surgery precisely. So in that way, ENT is a very good branch. It is a very peaceful branch because all the consultants and senior usually in all the centers in our country are very peaceful. They are not so aggressive in nature. The timings of the duties are uh, relatively easier than other surgical branches. I won't say that it's very easy, but compared to other surgical branches like gynec, orthopedics, and all that, you will get some time of relaxation during your residency. Uh, the other thing is that if you want to explore more in your life, okay, like if you want to learn more surgeries in head and neck, then ENT is also a very good branch. And rest is all, it all depends on your interest, that whatever interest you develop in the subject during your UG days, you read all 19 subjects, you appear for your NEET PG examination, and you discover that which branch you are suitable for. So that would generate some motivation, self-motivation inside you to take any branch, not only ENT, then any branch. And you will be more clearer in your picture about your branch when you will do your 1 year internship. Internships will make the picture clear that which branch you are made for. Not which branch is the best, but which branch is most suitable for you and your personality. Okay. And cons, I would say that the cons is that you can't do anything below clavicle. So that is one con. If you take it as a con, but I don't want, like I didn't like GIT and GUT surgeries. Okay. And and I didn't like gynec surgeries too. So that thing is not, may not be a con for me, but it can be con for some people, that some people want to do head to toe surgeries. Okay, so they can go for general surgery. And if you are not interested in anything below your clavicle, then ENT is the best branch. If you want total head to toe surgery, then you should not go for ENT. You can take a general surgery. Okay. Then other con, I can say that the cons, I don't remember much cons. Yes, and pros is another thing is that uh, I would like to say that there are in the market there are lots of general surgeons right now, and even most of them have done their MCH. You can find a list of neurosurgeons, a list of cardiothoracic vascular surgeons, a list of gastroenterologists. Okay, so you have to fight a lot to stand in the competition of today's society if you are a general surgeon. Okay, and in today's scenario, people are so concerned that even if they get a headache, they will go straight away to a neurologist or a neurosurgeon. Nobody is going to come to MD medicine or MS general surgery to see for a headache. In today's scenario, I'm talking about. But for a ENT, I would say that if you have a ear discharge, the every people will go to only and only ENT surgeon. There is no other option for that. If you have a mass in your nose, if you have a discharge from your nose, if you have a neck swelling, okay, then only ENT surgeon can treat that thing. Okay, and the surgeries of ENT are so precise that only ENT surgeons are able to do that. No general surgeon will ever take that courage to touch the temporal bone or to touch the skull base or to touch the neck. Okay, they won't do that, never, because everything is done in today's era endoscopically and microscopically. So why would they take a chance? So that in that way, ENT surgeons have a precise domain. They have their area. कहते हैं कि इस इलाके का हम शेर हैं. Okay, so head and neck के हम शेर हैं. You can say like that. A general surgeon, a neurosurgeon, I have seen a neurosurgeon doing hernia. Okay, cardiothoracic vascular surgeons doing hernia hydrocele. Okay, but no one will ever try to do mastodectomy. No one will ever try to do a fast surgery, even though they are a neurosurgeon, even though they are a cardiothoracic surgeon. So your surgery are only your surgery. No other people is going to touch it. So the population having the complaints in head and neck are only and only going to come to you. They won't go anywhere else. And relatively, the population of ENT surgeons in the market today is not so much. The doctor population ratio is very less in ENT. So per ENT surgeon, there are many patients to do. In our OPD, we get on an average 250 to 300 OPDs per day, including the morning and afternoon OPDs. Every day, 250 to 300 OPDs. And we do on an average 6 to 10 surgeries daily, including local and general surgeries. So that is the workload which we are facing right now in ENT. Rather in surgery, there is single emergency, 1 day emergency in entire week. And they get 500 to 600 patients in that single day. And that we see so that much patient in 2 days. They see in 1 day in 1 week. Okay. Weekly they see one OPD, there they see 500 patients, not more than that. Every day they do 2 surgeries in a week, not more than that. And we do 6 to 10 surgeries per day. In their one unit, there are 3 to 4 residents. Here in one unit, we are only 2 or 3 residents. And they have 6 units, we have only 2 units. So if you see that the surgery is done per doctors which do the surgeries, okay, so surgeries done by per doctor is more in ENT compared to general surgery. I'm not talking orthopedics because it is mostly trauma based. The trauma cases come tremendously in orthopedics, and in gynec also there are many deliveries and all that, so they can get enough work. I'm comparing with general surgery and ophthalmology. Ophthalmology is very limited branch. It is also a minor branch which stands in the domain of ENT only, but compared to ENT, the domain is only one globe. Inside the globe they have to stay. And during your senior residency in ophthalmics, you can't go behind the retina. Or in some centers, they are not allowed to go even behind the lens. Okay, but in ENT, I am a senior resident, and today I can do atiquantal surgeries also. I can do facial nerve decompressions also, and I can even assist in cochlear implants also. I can even do skull-based surgeries. I can do modified radical neck dissection also. So you get the majority of the surgeries in ENT you can get by the time you are a senior resident, compared to general surgery or a ophthalmologist. And there you have to do so much of MCH fellowships. You have to do. So that is the list of pros and cons according to me in ENT.
And what kind of personality should be going for this branch?
Anybody can take ENT. It's not a specific like you should be bold or aggressive. You want some physical work. You have to insert nails and screws and all that. There's nothing like that. Anybody can take. Even a calm person can take ENT. Even an aggressive person can take ENT. Okay, it's not like that. You just need a dedication and interest in the branch. If you like the head and neck, then you can, without giving a second thought, you should take ENT. If you want a surgical branch, then if you are thinking that should I take a surgical branch or should I go for non-surgical branch, then I would suggest that you should go for the non-surgical branch. Because if you are a surgeon, then it should come from your heart. You should not give a second thought whether I should take a surgical branch or not. Now in surgical branch, you should think yourself that whether I'm interested in handling the trauma, whether I'm able to handle all the aggressiveness and toxicity of the orthopedic branch, whether I want to do all head-to-toe surgeries, whether I want to do the deliveries, whether I want to stay within the globe of the eye, or whether I want to do head and neck. These things have to be segregated inside your own mind. First of all, you have to select whether you want to be a surgeon or a physician. After you have decided that you want to be a surgeon, then you should think that which kind of surgeon you want to be. So according to me, anybody who is interested in the head and neck, who want to treat the head and neck pathologies, who are interested and they want to find out the new disease and new approaches and new surgeries of head and neck, all those people can very well join the branch. There is nothing like that. There only girls can come, only boys can, nothing like that. Anybody can come, and anybody can be successful in this branch. You just need the determination, you just need the perseverance inside you, and you should have the interest in the branch. That's it.
Definitely, sir. Because ENT is both a surgical branch and a medical branch. It's like I can sit in a OPD for a day and next day I can be in the OT.
Yes.
So we can
Yes,
have the combination
absolutely.
of being as a wizard,
Absolutely.
being as a wizard in medicine, and definitely being as a craftsman in surgery also. So we get the benefits of both.
Absolutely. And even though
Yes. So
when you prepare the patient preoperatively, you know how to manage diabetes, you know how to manage the hyperthyroidism, you know how to manage a hypertensive patient. We even manage the DK patient independently. We don't need a physician reference. We need only on paper reference that okay, we have taken a consultation from physician. That's it. Rather, all the insulin, glargine, everything we only manage. So being a ENT surgeon, you even come to know it's not like that I'm left away from physician. Like I can't practice medicine because during my final year, medicine was one of my favorite subjects, and I was in dilemma because I wanted to be a surgeon. That was fixed, but I was in a grief that yeah I won't be able to do medicine. How can I practice medicine in my life? Okay, but when I joined ENT, I found out that it's it's 50% medicine, 50% surgery like that. There is no pathology in ENT which you can't treat by medication. And even before surgery, you have to go like it's conservative management, medical management, surgical management like that. So in medical management, you can go through all the drugs which you have read in your pharmacology. I can say that. You can't take a hypertensive patient in your OT. You can't take a hyperthyroid patient in your OT. You have to make him normoglycemic. You have to make him normotensive. Okay.
And what is the monetary aspects involved with this branch, sir?
Sorry.
What is the monetary aspects involved with this branch
Monetary
after
aspect, it
residency?
depends on okay, it depends on whether you want to continue in your government setup or whether you want to go for private institution. If you I would say that in today's era, even a government surgeon can earn a very handsome money. Okay, they can get a 2.5 lakhs per month. If you are a associate professor, you are a you are a consultant in a good civil hospital. Like in Baroda, our consultants get 2.5 lakhs per month. So I don't think that this is a less money. uh, you can live a very good life. In monetary terms, you are very in a stable position. But if you go in private, then it all depends on your repo and your name in the society. It all depends on the practice. You may even earn 5 lakhs per day. Okay, one master surgery is 5 lakhs. You do one master surgery per day, you get 5 lakhs rupees. That like that. One tracheostomy you do, it costs 50,000. Okay. Tracheostomy, I used to do 5 to 6 tracheostomy per day in my hospital when I was in second and third year. 5 to 6 tracheostomy. Okay, one tracheostomy cost 50,000 in private. So 2.5 to 3 lakhs. If I was in private, then I would have one in one day. Okay, but that all depends on you. You in private, you may not even get patients. Okay, so that all depends that whether you are in a good private institute, whether you are in a government, but wherever you are, you will get a handsome six-digit salary. That I can say. And if you are
Should
a
one
doctor, then
practice
there is,
in
yeah, if you are a doctor, then you should not be concerned about monetary terms. Whichever branch you, even a pathologist, even a microbiologist, even they earn very good. So if you are a surgeon, then there is no question about the monetary terms. It all depends on your interest. It's your passion.
and should one practice in the government setup or corporate setup, or should one go for a personal setup according to you, sir?
See, if you want to explore all the ranges of patients, okay, like the infective patients and all the standard patients having a neoplastic etiologies, okay, then I would say the government setup is the best. Because mostly infective and all these septic patients, they come from a poor socioeconomic class, so they won't afford to go in a private setup, so they would come in government only, and there you will learn how to manage the septic patients also. Okay, whereas in private setup, you will get all the patients who want to get them cochlear implants, you want to have a facial aesthetic surgeries, okay, like all those high-fi patients you will get in private. Okay, but the things you have to learn from government is that how to manage the patient from scratch. Okay, right from starting, you get a very septic patient, you have a patient who has have a very bad RTA. Okay, all these areas necros or everything is gangrenous. Okay, so how to manage the patient, how to make his skin healthy, how to make it functional, how to resolve his sensory deficit, motor deficit, all those things you will learn in government mostly, because RTA patients are taken by 108 ambulance in Gujarat, and they are taken to government hospital only. Okay, so you will learn maximum to manage RTA, foreign bodies, okay, carcinoma, maggots, and all these things, septic patient in government. In private, what you will learn is how to behave with a patient. Okay, I would not say that this is a very bad practice that you behave very. I have seen many doctors and residents, they don't behave very in a very nice in government hospitals. Okay, if a patient is poor, there are many patients. The entire ward is full of patients. So and there is one resident amongst them. So Maybe he's frustrated, but I would say that you should not do like that because patient is in pain. That thing you can't do in a private. Okay, in private you should have a rapport. You should know how to behave with a patient. So doctor patient relationship you can learn very good from private. You can't prescribe anything to the patient from government because patient has come in government to take a free service. Okay, everything you have to manage from the government supply, whereas in private you can prescribe whatever you want. Patient will not ask you a second question that why do you want this. Okay, and another thing is that during the consent taking, mostly the people who come in government setup are not so literate, so they won't ask you cross question like if you explain the probability of facial nerve palsy during a mastectomy. Okay, so poor people will say कि कान में से अभी पस आ रहा है आप ठीक कर दो जो आपको सही लगे आप कर सकते ठीक है, but in a private they will say that why my mouth will go like this, I can't afford to say like this my whole life. Okay, that all questions you have to be ready to face, how to tackle those technical questions. Okay, you have to satisfy their their emotions. Okay, even many patients will have ego that no, I want a scarless surgery, my scar should not be present. Okay, all these things you will learn in private. So there is a mixed approach which you can learn from both. So I would say that you can have a good rapport with some private practitioners. You can go to their place. You can learn surgeries there also. Okay, there they will teach you how to talk with patients, how to manage well with patients. Okay, and in government you can learn how to treat all the septic patients from the scratch. Okay, all the septic patients, RTA patients, foreign body, everything you will come to learn. It means there is no case which don't come in government. You will see all the levels of patients from simple case to technical advanced cases in government. Okay, so you can have a experience of both the sectors. You can have the experience.
How about if one wants to go for a personal setup?
Okay, personal setup you can go, but for that you should have the knowledge that you can manage the patient, and if there is any complication, then you can manage it by yourself. And for that you should have some rapport in your city. Whichever city you want to practice in, there you should have some rapport. And rapport you can get only, means the best source where you can get the rapport is a government setup, because in government maximum patients come during your practice of 4 years of residency. At least the entire population of your city must have at least come to your OPD. Okay, and मतलब 4 साल में कोई एक बार तो बीमार पड़ेगा ENT का, तो they would have come and they would have seen your face that okay ये डॉक्टर को हमने देखा है. So if you start a government setup after practicing for few years in your government hospital like a consultant, like a AP or associate, then the patient may come to know, okay, this doctor we know, we have seen his work when he was working in his government hospital. So then you will get a better chance to attract more patients when you start your personal setup. Just right after passing out from institute, if you start if you start your own private hospital, then there are high chance that patient won't come to you in the beginning, because there may be more pioneers in your own city, in your same branch, who must have been practicing since last 15 to 20 years. Okay, so patient would obviously like to go there. They want to get operated by the hands of an experienced surgeon rather than giving a chance to a newcomer. Okay, even we always want to go to a senior person. Okay, we won't go and go to a junior consultant, and we would go and, because this is a face. Okay, everyone is concerned for that face. Okay, nobody wants to get some complication in their head and neck and face. Okay, so regarding your personal private, I would like to say that first you should practice in some super specialty or some multi-specialty clinic or your government hospital, and then once you have your rapport in your city, once you get enough training in your surgeries that you can perform all these basic surgeries without help of your seniors, then you can start your personal clinic.
How about life after residency?
Life after residency. What can be a life of a doctor? A doctor is considered as the most prestigious branch of the society. Okay, even if you are in ENT, even if you're in gynec, even if you're a pathologist, your life has to be the best in the society. Okay, you just have to pass the first year of your residency. That is hell. I would say that is nothing less than a hell. Okay, you would get all the scoldings of your seniors, you will get all the insults. whichever insults you can ever bear in your life, you will see on your first year residency. But at the end of a tunnel, there is always a sunlight, and you have to keep walking towards the sunlight. Okay? Once you finish the tunnel of your first year, you will enter the sunlight of your second residency. Okay? From that, you will get the feeling of a surgeon that, okay, I am a surgeon now. In first year, you may just hold the retractor. You may be making files. You may be taking histories of the patient, nothing else. You will feel that I'm of no worth here. Okay? I have taken a surgical branch. Why am I doing all these things? You will get such questions in your first year. Okay? Once you finish your branch, once you become a consultant, okay, you will get the patients, you will do the surgeries. Then you will have fulfilled your passion from within. So you will have the internal happiness. You are getting a handsome salary. Your family is happy with you. Okay, everyone, all your relatives are happy. They are proud to say that my son or my daughter is a surgeon. Okay, so your life is absolutely fine. Your life is best. You can get the best life in a society. Wherever you go, you can say that I am a surgeon, I'm a physician, I'm an ENT surgeon. So there you can, everyone will look at you with tremendous respect. Okay, so life after ENT or all the surgical or all the physician, everyone has a very good life. And I am saying it in a general way, not only ENT, everyone has a good life. If you are not only doctor, any branch, if you are following your passion wisely, if you are following your passion with full dedication, and if you are happy with your branch, then you are absolutely happy. To stay happy, only one thing is required, that you have to be happy. If you are happy, then you can stay happy with anatomy also. If you are not happy, then you can't, you will be sad even if you are a radiologist also. Okay, you would compare that, वो तो ज़्यादा कमा रहा है, मैं तो खाली दिन के 10,000 कमाता हूँ, वो तो लाख रुपए कमाता है. Then you will be sad. You have to see the brighter side. You have to see that the half glass is full, not empty. Okay, I am happy with my branch. That's why I am absolutely happy. My life is good. If you are happy with your branch, then your life will also be good. You just have to enjoy your branch. That's it.
What is the future scope of ENT as a branch, and will there be a takeover by artificial intelligence?
There is nothing like a takeover by the artificial intelligence. Artificial intelligence follows the command of human beings. Humans don't command the follows of artificial intelligence. And AI has already entered the field of ENT by robotics, telesurgeries, okay, cobbletter assisted surgery. I can sit here in my room and I can do surgery there in my hospital. Okay, that is called telesurgery by using robots. One such surgery has already been done in Gujarat at GCRI Center. Robotic assisted minimally invasive thyroid surgery. Okay, all the thyroid surgeries, parathyroid surgeries, base of tongue surgeries, okay, adenotonsillar hypertrophy surgeries, laryngeal surgeries, skull-based surgeries. All these surgeries have been taken. You can't say taken over. You are only doing. We only do the robotic surgery. Robot doesn't do the surgery. He doesn't know where is the lingual artery. He doesn't know where is the hypoglossal nerve. We know that. We are controlling the robot, but it's just that we have a better dexterity. Okay, we have a better range of motion. We have a increased mobility. Okay, all those things. We just go towards the improvised version of whatever we are doing today. It is not like taking over. Okay, I don't think that there will be any time that AI will take over humans. Okay, there is nothing like that. Humans will always control the AI, but AI will always help you to make your work easy. You will sit in a console in a room. You can operate the arms of the robot. You can do the surgery. By sitting in my home, I can do the surgery. I need not go in OT also. Okay, all these are just advances, and these are the positive. These are the positive sides of the surgical branch.
True, sir. What I have understood from whatever you have told is you have the knowledge and there is someone else doing it for you in the form of a robot or something, isn't it, sir?
I am only doing. Robot is not a person. He doesn't have a brain. Okay, he just has 6 arms, and all his arms are under my control. Okay, whatever I'll do from here, from the console, whatever my foot pedal will do, that work will be executed there at the end of the robot. So brain is mine, arms are of robots. That's it. Because somewhere my hands can't reach, but the robot's arm can reach. Okay, and ENT, you have to work in the depth, in all deep cavities, in neck pockets, in mastoid cavities, in skull base. Okay, all those areas Maybe my endoscope can't reach, maybe my suction tube can't reach, but the arms of the robot can reach. So that's why I'm using the robot to make my work easy. I'm not helping the robot to make his life easy. I'm using the robot to make my life easy.
Yes, sir. Got it. And will there be any, is there any compulsion for any super specialization or fellowships post MS ENT?
See, in MS ENT, there is nothing like compulsion. MS ENT is itself is more than enough. Okay, by the time you complete your MS ENT, you should be able to do all the basic surgeries in ENT by your own. Okay, if you can do the surgeries by your own, you don't need any super specialist. If I can do neck dissection, then I don't need the patient to refer to oncosurgeon. I would like to say that after ENT, there are many fellowship programs, 6 monthly, 12 monthly, 18 monthly. Okay, if you want, then you can go to those programs and you can learn some extra skills. There is nothing like compulsion, but like a neck dissection is done by me also. Neck dissection is done by oncosurgeon also. But the thing is that the precision with which the oncosurgeon will do the neck dissection may be more than me. So I can go to the oncosurgeon for a fellowship program of head and neck surgery. I can go and learn there just to improve my skill. It's not a compulsion. I want to learn something more. Okay, so that is something a personal interest as per ENT is concerned about. Okay, there are many fellowship programs for laryngeal and voice surgeries, phonosurgeries, skull-based surgeries, endoscopic and skull-based surgeries, cochlear implants, 360-degree skull-based surgeries, laryngeal surgeries. Okay, even thyroid, parathyroid surgeries. Okay, even obstructive sleep apnea surgeries are being trained in many centers. Okay, even temporomandibular joint arthroscopy is being taught at many centers. Okay, even maxillofacial trauma surgeries are taught. So it's all up to you that how much you want to learn in a branch. Okay, in some centers even cobbleter assisted surgeries are taught. Okay, here in my center, cobbleter, microdebrider, laser, everything is available. Okay, so to learn cobbleter, I don't need to go anywhere else. My consultants will teach me to how to use a cobbleter, how to use a laser. But in some centers, the cobbleter is not available. So those residents or those surgeons have to go at a training institute. They can enroll themselves in a 6 monthly fellowship program for a cobbleter assisted surgery, and they can learn there. After learning there, they can go to the center, they can buy a cobbleter, and they can teach to their juniors. Okay, that's how the trend changes. In my institute, we had started a cochlear implant program in 2019. Okay, at that time, faculties used to come from different parts of the country to teach cochlear implant. But right now, my consultants can do cochlear implant independently. Same goes for obstructive sleep apnea surgeries, the uvulopalatopharyngoplasty. There was a program in 2020. Then the faculties used to come from India and they taught us the surgeries, UP3, okay, and mandibular advancement surgeries, okay, all those things they have taught. So now we can do all the surgeries by our own. So now I need not do the fellowship in these things. I can go for fellowship for skull-based surgeries because like the transnasal endoscopic third ventricular stomy. All these surgeries are not yet done in my institute, but we do the transnasal endoscopic pituitary resection. Okay, so that I can learn from my consultant, but if I want to explore more to learn the brainstem and the posterior cranial fossa tumor transnasally, then I need to go to some fellowship program institute. So after ENT, MCH, fellowship, it all depends on your personal thing. Like I told in the beginning of my interview that people right now for headache will not go to a general surgeon or a general physician. Where they will go? They will go to a neurologist, they will go to a neurosurgeon. But for ear discharge, where will they go? They won't go to a skull-based surgeon. They will come to MSENT only. If I am not capable of doing the surgery, then only I will tell him that बड़े doctor के पास आपको जाना पड़ेगा. Okay, but if I am capable of doing the surgeries, then I will not refer the patient. I will manage the patient by myself. So it all depends on me. It all depends on the resident, how much you want to learn. If you want to learn each and every surgeries of your branch, you can do all the fellowship programs. You need not do any MCH program. Because after MCH, after ENT, only one MCH program is available. That is head and neck oncology. Okay. Last year, there was a JR that ENT surgeon can go for neurosurgery also, head and neck plastic surgery also. But for that, I have to learn the entire general surgery again. So that makes no sense because I don't want to work below clavicle. Then why should I learn everything again? any head and neck onco surgery, if I pursue MCH, then I won't be able to do the general ENT surgery. I will always have to do the head and neck onco surgery only, and that would be very boring for me. I would be fed up if I go entire life I would do only onco surgery. I need some mastered. I need to use endoscope. I need to do FAS. I need to do neck dissection. Okay, I need to do tonsil. Or to do all those things, I have to stay in my MSc only. I can go for fellowship and then I can revert back to my MSc and use the knowledge which I gained in the fellowship, and I can use in during my practice of MSc only.
That's great, sir. You have answered every question with utmost patience and in a very beautiful manner. Thank you once again.
Thank
And
you.
lastly, do you have any special? Yes, sir. And lastly, do you have any special message to our viewers?
To all the juniors, I would just like to say, just follow your passion. When you are in your UG undergraduation, you don't focus that I want to be a gynecologist, so I won't read ENT. I won't read option. Or if you want to be an ENT surgeon, you would say I won't read gynec. I won't read surgery. Like that. You should not have that approach. Like I said, there's a 360-degree skull-based surgery. I found that you should be a 360-degree 5-star doctor. Okay? Right now, if a patient comes to me that I have a hernia, patient means I have a hernia. You will say I have a lump in my lateral part of the stomach. What should I do? And I should be able to explain him that first I will revert your intestinal contents. I would keep a mesh. I would do a hernioplasty. All those knowledge I should also have being an ENT surgeon. So first, if you are a UG, then read all your 19 subjects as if you are going to take all these 19 subjects in your future. You should have your pathology clear. You should have a micro clear, physio, biochemistry, medicine, surgery, anatomy, everything, all the subjects should be on the tip of your tongue and the tip of your finger. Okay? If you're clear with all your first, second year branches, then you will get all the clinical branches very easily. You can sail through those clinical branches very easily. Because clinical branches are very easy. There is nothing like imagination. Whatever you see, you treat. Okay? I have never seen a molecule of ATP in my life. Okay? Biochemistry, Krebs cycle, I have never seen that cycle. I have never seen in my life. I just in the imagination. But I can see a polyp. I can see a thyroid tumor. Okay? I can see the cholesteatoma matrix. Okay? Whatever I can see, I can remove it. So what my message to you is, learn all your 19 subjects thoroughly as if you are going to do PG in all those 19 subjects. After that, you choose wisely that which branch you are made for. Okay? You, by looking at others, that okay, he is taking radiology, so I will also take radiology. To be frank, and I'm not offending any radiologist here, but I don't like a life of black and white. Okay? Black and white ki zindagi, CT scan, MRI, X-ray, okay? It is good. Even ENT surgeons should know how to read HRCT temporal bone, okay, CT PNS, okay, everything you should know. But only doing radiology, it's not my cup of tea, sorry. So I ruled out radiology, even though it is a first branch. Everyone is taking, still I don't want to take. Why? Because I don't like a black and white life. Okay? Like gynecology, it is a very cream branch. It is said that in India it is like a evergreen branch. Okay? Population is increasing day by day, so gynec and PD are going to be the bread and butter branch of India. But I don't like the anatomy of gynecology. I can't handle two lives at the same time. All those things. There are some personal choices. Like you should have something of known of yourself. That what I can do in my life. Okay, what others are doing or what the topper has taken. First ranker ने medicine लिया है तो मैं भी लूँगा. I want to hold a scalpel. That is what I know. Okay. If I want to hold a scalpel, that means that medicine is ruled out, pediatrics is ruled out, pulmo, skin, psychiatry, everything is ruled out. Okay. Whatever is left, surgery, then obs, gynec, orthopedics, ENT and ophthalmology. Okay. Out of that, what type of anatomy I like, what type of region I like to operate on. I don't like the anatomy of gynecology, so I won't take OBG. I don't like the aggressiveness of orthopedics. I can't handle so many trauma patients, so many like so heavy and stressful life. Okay, so I won't take orthopedics. I don't want to work only in the globe of orbit. Okay, I want to do something more, so I won't take ophthalmology. I don't like GIT and GUT, so I won't take general surgery. Okay, it's all about me. Okay, I only know Dr. Gaurav. I don't know anyone else. Okay, you should know yourself. Like know your calling, what the topic is. You should know yourself first. That what you are meant for. आप किस चीज के लिए बने हो. That should be your first call. अगर आप pathology, I even seen the toppers taking pathology, toppers taking PSM. They have a goal that after doing community medicine, I would go at UNESCO or I would go at WHO. That level of perseverance, that level of goal you should have set in your mind. That even if you are first rank, I will take PSM only, I will take community medicine only, I will take pathology only. That amount of guts you should have. Society क्या बोलेगी कि first rank आया तो भी PSM लिया, that should not be in your mind. And each and every branch in all the 19 subjects are important. The hospital won't run even if there is absence of any one subject. We need pathologists also, we need microbiologists also, we need radiologists also. Okay, we need all the anatomists, biochemistry, we need everybody. Everyone is important in their own aspect. Okay, so there is nothing like a topper branch. Okay, नीचे वाली branch, ऊपर वाली branch, nothing like that. For me, all branches are ऊपर वाली branch. Every branch is good unless you like the branch. There is nothing like that only if you are first time you should go for medicine, you should go for radio. Nothing like that. You find yourself what you are meant for. You can take that. That's what my message for you all is. But don't forget to read all the 19 subjects thoroughly as if you are going to do PG in all the 19 subjects. That is the main message which I am going to give you right now.
Thank you once again, sir. Hope your wisdom guides us all in
Okay.
our future endeavors.
Okay,
Yes.
thank you very much.
Shall I stop?
All
Yes.
the best to everyone.
Thank you, sir.